forceful vomiting के बाद patient had a very severe chest pain. This is a rare but a very deadly surgical emergency condition. So let's discuss it today. So today we have a 45-year-old male who is a heavy drinker, and after a party he had multiple episodes of vomiting, and 2 to 3 hours after that he had a very severe chest pain, and along with the chest pain he also developed breathlessness, tachycardia, and patient came to the hospital in the state of shock, and on examination there is subcutaneous emphysema, and on chest x-ray you can appreciate there is left side of pleural effusion, and along with that there is air in the mediastinum. So what do you think? What is the diagnosis of this case? Is it a case of myocardial infarction? Is it Mallory-Weiss syndrome, or is it a case of Boerhaave syndrome? So the answer of this case is this is a case of Boerhaave syndrome, and it is a very severe, very deadly surgical emergency. So what happens is Boerhaave syndrome में full thickness tear होता है esophagus का, and in Mallory-Weiss tear there is only tear in the mucosa, so it usually presents with more episodes of hematemesis, and the sepsis, subcutaneous emphysema, and these kind of features are very rare in Mallory-Weiss tear. And in Boerhaave syndrome, there is complete tear of all the layers of esophagus. So that leads to leakage of content in the mediastinum, mediastinitis, that leads to sepsis. And patient is in a very severe condition. So why it occurs? When there is forceful vomiting and the glottis is closed. So pressure gets built up inside the esophagus that leads to tear of the esophagus. And this tear usually occurs at the left side of the gastroesophageal junction. So that is why the pleural effusion usually occurs on the left side. For the diagnosis of this case, the clinical history along with the chest x-ray findings are important, and we can diagnose it by that. And if we are suspicious and we are not able to make the diagnosis, then we can go for a contrast esophagogram with a water soluble contrast. Remember it, water soluble contrast. And on CT chest also we can get air in the mediastinum. Management part, it is a surgical emergency, so it should be managed very fast. The core management part is simple. It is ABC, airway, breathing and circulation, along with IV fluid and IV antibiotics. Patient should be kept NPO, nil by mouth, and nasogastric decompression should be done. And early surgical repair of esophagus is advised, and if it is delayed, then the mortality in these cases is very high. So remember this case. This can very well be asked in your exams, asked in your vivas, and in your ward rounds also. So do share it and do save it, and do follow Diagnose It for more such interesting cases and videos. Thank you.